This is an article that just came out today, July 31st, 2017, and CBS News. Significant spike in opioid-related car crash deaths, which I'm not surprised. Drug driving is through the roof. I mean, really, literally, none of us are safe on the road with these fools out there. And yet another sign of just how deadly the U.S. opioid plague has become. Researchers report a seven-fold increase in the number of drivers killed in car crashes while under the influence of prescription painkillers. Prescriptions for drugs such as oxycodone, hydrocodone, and morphine has quadrupled from 76 million in 1991 to nearly 300 million in 2014. So it's no surprise that these medications are playing a growing role in highway deaths, the Columbia University researcher said. The significant increase in proportion of drivers who test positive for prescription pain medications is an urgent public health concern, said lead researcher Sanford Chahuri. Prescription drugs can cause drowsiness, impaired thinking, and slowed reaction time, which can interfere with driving skills, Chahuri said. Prescription pain medication use and abuse may play a role in motor vehicle crashes, he said. Additional research is urgently needed to assess its role. Chahuri is a staff associate with the Department of Anesthesiology at the College of Physicians and Surgeons at Columbia University Medical Center in New York. He isn't the only one worried about the trend. MAD, Mothers Against Drunk Driving, is concerned about the rising use of opioids across the nation and the effects of these drivers have on the safety of our roadways, said J.T. Griffin, Chief Government Affairs Officer at the nonprofit organization. Unlike alcohol, there is no reliable test for impairment by other drugs, Griffin explained. MAD has always served victims of all substance impaired driving and remains committed to eliminating drunk driving and fighting drug driving, Griffin said. For the report, Chahuri and co-author Dr. Lee, a professor at the Columbia Mailman School of Public Health, studied 2 decades of data from the Fatality Analysis Reporting System, which was created by the National Highway Traffic Safety Administration. Chahuri and Lee focused on drivers who died within 1 hour of a motor vehicle crash in California, Hawaii, Illinois, New Hampshire, Rhode Island, and West Virginia. These states routinely test for drugs in people who have died in car crashes. Of the nearly 37,000 drivers in the analysis, 24% had drugs in their system, of which 3% were prescription narcotics, the researcher found. Among the 3% of drivers who tested positive for prescription narcotics, 30% also had high levels of alcohol and 67% had traces of other drugs, Chahuri and Lee said. More women than men tested positive for prescription narcotics, 4% versus 3%. Among male drivers killed in car crashes, the prevalence of prescription narcotics increased from less than 1% between 1995 and 1999 to slightly over 5% between 2010 and 2015. Among women, the increase went from slightly over 1% to more than 7% within the same time frame, the researcher found. The report was published online recently in the American Journal of Public Health. The opioid epidemic has been defined primarily by the counts of overdose fatalities, Lee said in a statement. Our study suggests that increases in opioid consumption may carry adverse health consequences far beyond overdose morbidity and mortality. One travel safety expert said it's difficult to tell if the increased presence of prescription painkillers were due to increased testing for it over time. Also, it isn't clear if the protocols used to test drivers who died in car crashes was the same from state to state, said Jim Hedlund, a spokesman for the Governor's Highway Safety Association. From these data, the extent to which narcotic painkillers were the cause of a car crash also isn't clear. The presence of a drug doesn't imply impairment, Hedlund said. Despite that, I believe the conclusions of the study are correct. They are finding more opioids in dead drivers than there were 20 years ago, he added. That goes along with the trend in society of more opioids being prescribed and more opioid deaths. It's up to doctors and pharmacists to tell their parents that these drugs can impair driving and not to take them when they drive, Hedlund said. But you know what? They do. I mean, look, these people inject heroin with needles while they're behind the wheel on the road. So, of course, they're going to pop their pills before they get behind the wheel. That's a shame looking at these wrecked cars. Wow. That's crazy. But this is our reality, ladies and gentlemen, under the drug plague that's going on. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family.